because this is live treatment, right? So I don't want to spend too much time before we actually show you something live. Okay, so Dr. Waltuck alone, okay, he's going to go ahead and take a scan of TEDRA so we can collect the data. Okay, to set up and start the process is very simple. I have a cart system that I roll around. Here we're using a laptop system. They kind of tell me most people prefer the laptop system. But you enter the patient's name. You click on the button that says Study Model, and that's it, and you're ready to go. There's no complex setup that's involved in going ahead and doing that. So, okay, go ahead, let's scan. Oh, can we switch it to the screen of the scanner itself? Okay, there we go. Okay, so it's telling us now that we were going to start with the mandible, right? And here's how quickly it operates. It's full color. You can buy these in black and white and color. I personally like the color. There's no difference in the, let's call it quality of the image, but I think you can see things in the color. And certainly if, wow factor is an important part for your patient, color is certainly the way to go. And today I know with the other scanners, more and more of them are, implementing color in the machine. So you see, to go ahead and to scan an arch, right, is, you can do in, 15, 20, 30 seconds, okay? We're just going to do a quadrant because we don't need the entire arch. Okay, it's going to render that data. If there's, artifact or extra information, we can go ahead and trim it away. If not, now we're going to go and scan the maxilla. All right. Alona's just, filling in some of the missing data. Now, when you capture the data, if you're missing data, you'll see holes. If the hole is small enough, the software will fill in that hole. Generally, if it's an area that's important to me, if it was just for a study model, right, I would rather do it, quicker, right, and I'm not going to worry about every hole. If it's something that I'm now going to use to fabricate something on, and here we're going to fabricate something on from here, right, then I want to make sure I collect as much data as I possibly can. So here we are scanning the maxilla. Okay, so we're not in the age anymore of, click, 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 okay? It'll tell you here how many pictures did we capture. It was 348 pictures, and now it's going to stitch all those pictures together, and it gives us our image. And now we can go ahead and we can take a byte registration. Now, teacher's missing some teeth, and it needs a certain amount of space to go ahead and articulate that. So the computer may go ahead and do it, or we may manually manipulate it by going ahead and identifying points and allow them to integrate. Okay, so there we go. The computer decided it was happy, and it went ahead and gave us our byte registration. Now, we're not doing this here, but if you were going and going to use an intraoral scanner to go ahead and for a crown and bridge type of impression, you prepared a tooth, that's what you would do. And then you could press that button, and it'll go right to your laboratory, okay, right to the laboratory. And the laboratory can look at that data and tell you if you have enough interarch clearance, if there's enough space for the materials, if you need to modify your preparation, or they can begin working on the preparation roll. You know what? Take it off the articulation, and let's just kind of rotate the models around. Let's look at both arches. Okay, now one other thing. Anybody here ever have a patient? You put the restoration in, the patient comes back, and then they say, "Doc, I'm biting my tongue." Right? Something's biting your cheek, could be biting your tongue, right? And you have to try and identify, okay, what's that, overjet relationship? So in cases like that, right, if it's somewhat complex or easy to go ahead and see, all I do is take a scan, and I can look inside the patient's mouth. I can spin those models around, and I can look at the occlusal relationship from the inside. So there's all kinds of things you can go ahead and do it. I personally would not buy an intraoral scanner, right, just because it's replacing impression material. It's because of all the other things that we could go ahead and do. Okay. Thank you, Tidra. Step one, you can breathe a sigh of relief. You did great. Okay, let's go ahead and go back to our slides.